Hi, everybody. My name is Maia Dorsett. I am the medical director at Prodigy EMS, and we are producing a series of short videos to help everyone understand the Prehospital Pediatric Preparedness Project, which is a mouthful, but a really important national initiative. And because I have a lot of questions, I'm sure you have a lot of questions, I have enlisted experts that can help us all understand what is it that we are supposed to be doing? How can we start this process to make sure that our pre-hospital system is ready to take care of children? Dr. Owusu-Ansah, would you like to introduce yourself?
Hi, I'm very excited to be here. My name is Dr. Sylvia Owusu-Ansah. I am the Pediatric Medical Director for Prodigy, but I'm also the EMS Medical Director at UPMC Children's Hospital of Pittsburgh. I'm also the EMSC, Emergency Medical Services for Children Medical Advisor for the state of Pennsylvania, and have done a lot of work nationally in collaboration with HRSA on the Pre-Hospital Pediatric Readiness Project. So more than happy to discuss and answer questions related to the assessment coming up.
Hi, I'm Mark Pinchalk. I'm the Assistant Chief with City of Pittsburgh Emergency Medical Services. I oversee our clinical and quality improvement programs, and I'm on the EMS for Children's Committee for the Commonwealth of Pennsylvania.
Awesome. So excited to have you both here. So for those who are maybe hearing about this for the first time or have heard about it a little bit and don't quite understand what is the Pre-Hospital Pediatric Readiness Project, can you describe what it is a little bit? What is the goal and the purpose?
So great. Thank you, Maya. So the goal and the purpose is what we call to be PEDS ready. For every EMS and fire-based agency that dispatches to 911 or similar agencies of the like, to be able to be prepared, to be comfortable, competent, and confident in taking care of children. We'll get into the nuances of what that means and the different levels of how you can get there. But ultimately, the idea is that throughout our nation, our 911 and fire-based EMS agencies would feel comfortable, be competent, and be able to provide high quality pediatric emergency care to all of our pediatric patients.
Yeah, my take on it is it's really an opportunity for EMS to optimize the care we're giving to pediatric patients. Pediatrics is a small piece of our pie as far as clinical exposure, and even for us in an urban system, we don't see a whole lot of kids and even a smaller fraction of kids that are really sick and need acute resuscitation. So we look at this as an opportunity to just optimize and standardize the quality of care.
So this little series of videos is going to be going over the Pediatric Readiness Checklist. What is the Pediatric Readiness Checklist and how does it fit into this big overall project?
Yeah, to Assistant Chief Mark's point, the idea is for us to optimize pediatric emergency care throughout the nation with our pre-hospital pediatric readiness project. And just to make things simple, I'm just going to say PPRP from here on out, if everybody's okay with that. The checklist gives you an ability to look at where you are as an agency in regards to pediatric care. We look at 7 specific domains. It's not to say that one agency is better than another. It's really just to give you a foundation and a ground-based level as to where you are when it comes to taking care of pediatric patients. And so you kind of look at this as where you are foundationally as far as taking care of children and areas where you can improve. The checklist will help you to assess those things.
So from that, I can tell, like, why would it be valuable? So my understanding is that there isn't any required portion of this checklist. Really, the goal is that agencies use this as a tool to sort of self-reflect and assess where they are, what are their great opportunities for improvement to be more prepared. Kind of like if I have an intubation checklist, it lets me say, oh, I've got this, this, and this. Oh, I forgot this. How do I make sure that I have that resource? Am I interpreting it correctly?
That is exactly correct, Maya. And I think the analogy of having an intubation checklist or even equipment checklist would be similar but looking through the lens of an agency and care for a pediatric patient.
So why should agencies engage in the process of checklist completion? Because I've started to tackle this from a regional perspective. And I was like, wow, it's going to be a fair amount of work to sit down and sort of systematically go through. If you had to, I assume the city of Pittsburgh EMS is going to be engaging in this process. So I'm just interested in what you say, Assistant Chief.
Yeah, I think it's very valuable, and it's really becoming the standard of care to have checklists. So it's been pushed for a long time in the aviation industry or other high-risk industries to use checklist systems to make sure everything's get done. And it's becoming adopted more and more in healthcare, and it's working its way down to EMS. So I think it's really a good tool to really standardize the care, make sure everything's being done correctly, make sure we have the right equipment, so we can really optimize and care we're providing to pediatric patients and provide best possible outcomes. And what we've seen is it's kind of our older medics that have been around for a while, and I include myself in that, tend to rebel a little bit, although I'm very big on the checklist. But our young generation of medics who are coming in and coming up through the ranks really seem to buy into this, which is really encouraging.
So this checklist is the beginning of a process, because I hear there's a big assessment coming in May. So if I'm an agency leader and I need to say, when should I be putting it on my schedule to prioritize getting this done amongst all the other things I need to do, why is it something that I should be prioritizing now?
First of all, the PPRP assessment will be beginning in spring of 2024, which is only a few months away. Really, the assessment will begin starting in May of 2024. And as we said, the checklist is a means to help us to provide better, high-quality care for our pediatric patients, although a subset of our EMS patients, a very important subset of, I wouldn't even say subset, a very important portion of the patients that we take care of. And so in order to get ready for the assessment and to really have it be beneficial, it's important to kind of lay the groundwork and find out where your agency lands in that space as far as pediatric readiness. The checklist helps to kind of give you an idea as to where your agency lies in that readiness space. So that would be step one. And I think we'll talk a little bit more about how we'll go through the steps. After you've done the checklist, we do have a toolkit that's available to you with numerous resources as to how to better equip your EMS agencies if there are any deficiencies in any of the 7 domains that we'll talk about today. And I think we'll go more into depth a little bit later, but I think with the assessment coming up quickly, it would be important to potentially move this higher on the priority list of EMS agencies. And I understand, there's a lot going on in each EMS agency in the way of resources and priorities, but with the assessment coming up in a couple of months, I think it would be great to put this on higher on the list of priorities to get the checklist done and to look at the toolkit.
Great. So in the next section, what we're going to be doing is we are going to be diving in to the checklist, because I think sometimes we read something and we're like, what exactly is what we're looking for? Like, how do I know if I am meeting this objective of the checklist? So we're going to put together sort of a series of mini videos to sort of take you step by step, the 7 components of the checklist, so that you can take it step by step, like eat the elephant one bite at a time, take this checklist one section at a time, which is one of the great design principles of how it was put together.